Okay guys, welcome back. So let's talk about the bony surface markings. So first we're going to talk about the clavicles. Now here you can see the rib cage, right? Just imagine that the rib cage is inside, and these are the clavicles. I have them colored and highlighted for you right here. So the clavicles are also called the beauty bone or the collarbone. It's very easy to see. They form the collar. And they're also referred to as the beauty bone because they give shape to the chest and the neck. So the clavicle marks the boundaries of the upper part of the pectoralis major. Here we have our pectoralis major muscle. And this is the clavicle. So the clavicle forms visible ridges at the junction of the neck and the chest. So here we have our clavicles, and this forms a level. Above here we have the neck, and below we have the chest. As it is a subcutaneous bone, it is easily palpable throughout its length. So the medial ends of the clavicle articulate with the Manubrium sterni. So here we have our clavicle bones. And here is somewhere we can see the Manubrium sterni. You can see it very clearly over here. And this is called the sternoclavicular joint. Laterally, we have the acromioclavicular joint, because right over here is the acromion process of the scapula. This forms the acromioclavicular joint. And as you can see, the lateral ends help define the tips of the shoulder along with the trapezius muscle and the deltoid muscle. So here we have our trapezius muscles, and here we have the deltoid muscles. So what is the significance of this surface marking? They demarcate the superior division between the zones of lymphatic drainage. Above the clavicles, the lymph drains to the inferior jugular lymph nodes, also called the supraclavicular lymph nodes, right here. And below them, the parietal lymph from the body wall and upper limb flows to the axillary lymph nodes. So in the axilla here. Number 2, the sternum. So the sternum itself is a subcutaneous bone as well, and it's shaped like a tie. So here we have our sternum. You can see highlighted here. And like I said, shaped like a tie. Here's the bow. And here's the knot. And here's the tie. It is situated in the anterior median line seen between the two pectoralis major muscles on both sides. So in our surface of the body, or the chest wall, we can see the sternum right here. It's easily palpable, again, because it's a subcutaneous bone. And like I said, it's situated between the two pectoralis major muscles. So you can see the pectoralis major muscles on the lateral sides. And you can also see that it is situated in the anterior median plane, as we will be discussing later. So the sternum has 3 parts, as we can see: the manubrium, the body, and the xiphoid process, or xiphoid process. Both of them are valid pronunciations. In the body, we can see the manubrium right over here. and we can palpate the body throughout. And as we reach this part over here, we will be able to feel the xiphoid process. So what is the significance of the sternum? It serves as an important landmark to help identify the midline of the chest. And it serves to navigate different heart sounds, left and right, to some of the ribs, as we will see later. So we'll do the heart sounds in a bit. Number 3, the suprasternal notch. The suprasternal notch is also known as the jugular notch. It is felt along the superior border of the Manubrium sterni, so right over here. Just laterally, we have the sternoclavicular joints. So right over here. So the suprasternal notch is at the level of the lower border of the T2 vertebral body. So what is the significance of the suprasternal notch? The trachea can be palpated just behind this notch. So we'd see it over here. This is where the trachea would be. This would be important for us if we are trying to perform a tracheostomy. Okay, so number 4, now we have the sternal angle. This is also known as the angle of Lewis. So on a rib cage, we can see this line over here. This is palpated as a transverse ridge marking the manubriosternal joint. So on the body, we'd see it right about here. You would feel that small ridge between the two parts of the sternum, approximately 5 centimeters below the jugular notch. So this is like 5 centimeters. Okay, so and it is at the level of the second costal cartilage. So if you look closely in the rib cage over here, you can see here is the border of the manubrium, and this is the body of the sternum. So the costal cartilage, the second costal cartilage, it attaches and it's shaped like this. And this is a zoomed in version. This is the manubrium, this is the body of the sternum, and this is the costal cartilage. Second costal cartilage. So another important point is that the sternal angle is at the level of the IV disc, the intervertebral disc between the T4 and T5 vertebrae. Okay, so pause here for a second. The sternal angle is a very important landmark, and this is a potential question that a medical student may face on a ward exam. Like you may have a ward test on this, and your examiner may bring in a patient where you will be asked to examine the surface anatomy, or maybe on a written exam, you will be asked to enlist the anatomical structures that the sternal angle marks. So number 1, what do we have? The second rib, we can see here. This is the sternal angle, and this is the second rib. Okay, this is number 1. Now, the next thing that the sternal angle marks is that it divides the mediastinum into superior and inferior. So this is known as the inferior mediastinum, whereas this is known as the superior mediastinum. up to here, sorry. Let's redraw this. And just for your information, the mediastinum is only in the center. So the lateral parts are occupied by the lungs, whereas the central part of the thoracic cavity is called the mediastinum. This is the superior mediastinum, and this is the inferior. So what is the sternal angle mark? The division between the superior and inferior mediastinum. Okay, so now let's move on to the next structures that are marked by the sternal angle. The next 7 structures, they are all, you can all remember them as being related to the heart. So the first one is the end of the ascending aorta. So we have the aorta right here going up. Now this part here is the ascending aorta. So this marks the end of the ascending aorta. And naturally, it will mark the beginning of the arch of the aorta. So this is the beginning, this is the starting point. And the sternal angle also marks the end of the arch of the aorta. How many is that? 1, 2, 3. Now we have the start of the descending aorta. Okay, so number 3, end of ascending aorta. The start of arch of aorta. 5, end of the arch of the aorta. 6, beginning of descending aorta. So these 4 are related to the aorta. Now the next one is the pulmonary trunk. So here we can see the pulmonary trunk. So this yellow line here, this marks the, just for your information, this marks the sternal angle. So this, remember, it is marking all of the structures that are beneath it. Here we have the pulmonary trunk, as you can see, right over here. And at this level of the sternal angle, it divides into the right and the left. After this, now we're going to be looking at, see these right over here. We have these 4 red blood vessels right over here. Now normally the red color marks arteries and blue color marks veins. But in the heart, those blood vessels that are bringing the blood from the lungs, these are called veins, and even though they're red. So these are now the pulmonary veins. And this here is the pulmonary artery. So just remember that. So we were talking about the next structure that is found that at the level of the sternal angle. So see this line here again, this is the sternal angle. And where these four pulmonary veins are coming, this is marking the area of the beginning of the base of the heart. So you can't really see the heart in this picture because it's cut out. Here's a view of the heart. So remember, this is the apex of the heart. And this part over here is the base of the heart. So number 8, the base of the heart. And after that, we have the azygous vein that drains into the superior vena cava. So as you can see here, this vein right here that's traveling up behind here and opening in here into the superior vena cava. This vein is called the azygous vein. So at the level of the sternal angle, the azygous vein, it opens up into the superior vena cava. And last but not least, we have the cardiac plexus. The cardiac plexus is formed by these nerves over here. I'm not going to describe right now all of the nerves that participate in the cardiac plexus because we're going to be learning about that later. Otherwise, you'll get confused. But for now, all you need to remember is that the sternal angle, which if you look at this is the pulmonary trunk dividing into right and left, right and left pulmonary trunks. So we know that this is the sternal angle, and this is the cardiac plexus right over here. So cardiac plexus is number 10. Okay, so the next structure is the trachea. The trachea also divides into the right and left bronchi. So let's go back to the previous slide. You can see a better view over here. So here is the trachea going down. Now it's going to be behind these blood vessels. So it's dividing here into right and left. So the trachea divides into the number 11. Division of the trachea into right and left bronchi. That's it for all of the structures that are found at the level of the sternal angle. Okay, so now that we've discussed the sternal angle, the suprasternal notch, and the bones that are articulating with the Manubrium sterni, let me just describe to you the Manubrium sterni. How I see it, it is the shape of an octagon, like this. So this over here is the suprasternal notch. And this side over here articulates with the clavicle. So it's the sternoclavicular joint. This side over here articulates with the first rib. And this side over here, the bottom half of this edge, articulates with the second rib. And this side over here is the last one. This is the sternal angle. And these three are the same on this side. So I hope you will now remember all of the edges of the octagon-shaped Manubrium sterni. Okay, number 5, the infrasternal angle. Well, let's do the rib cage first. So on the rib cage, this is the infrasternal angle. So in the body, we would see it right over here. You could see a little bit of the bottom border of the rib cage coming up here. So this is the infrasternal angle on the human body, as we would see it in the surface features. So the infrasternal angle, it is the costal margin is formed by the 7th to 10th costal cartilages on both left and right, which creates the infrasternal or subcostal angle. The depression in the angle is known as the epigastric fossa. So what is the significance of the infrasternal angle? The epigastric fossa contains the xiphoid process. That's one of the significance. The other clinical significant point is if we are giving CPR to a patient, we would rather prefer to give CPR over here instead of over here, because sometimes the xiphoid process can break and puncture the liver. We don't want to do that. Well, now that I talked about the xiphoid process, so let's talk about number 6, the Xiphisternal joint. So the xiphoid process is a small bony projection of the inferior part of the sternum in the floor of the epigastric fossa. The Xiphisternal joint is palpable as a short transverse ridge. So here we have our body of the sternum, and this over here is where you would feel the Xiphisternal joint. Let me erase this for you. So this is the body of the sternum, and this is the xiphoid process. This is where you would feel the ridge of the Xiphisternal joint. It is at the level of the upper border of the T9 vertebra. So right behind here we would probably see, because these are now the last few thoracic vertebrae. So this is the T9 vertebra. So one of the more important significant points of the Xiphisternal joint is that it is one of the last bones in the body to ossify at age 40. Care should be taken to avoid excessive pressure on the xiphoid process during CPR by not keeping the hands so low on the chest. I already discussed that with you. Okay, so now let's start with the costal cartilages. So costal cartilages, this is number 7. These are bars of cartilage that contribute to the anterior part of the ribs. So when we're talking about the costal cartilages, we mean these red ones, not the orange. Okay? Medially, they insert into the corresponding notches. So right over here. We have notches in the sternum body, and they insert into these notches. And laterally, they articulate with the corresponding bony part of the rib. So as you can see right over here, they're articulating with the bony part, and this is the cartilaginous part. Together they make the entire rib. So they can be palpated along the borders of the sternum, inserting into their respective notches. So we can feel them right here in different places. This is not really something that I can show you on this slide. You would have to feel it in the body to feel. But you would feel small ridges where the ribs are inserting into the sternum. Okay, so what are some significant points relating to the surface anatomy of the costal cartilages? So we know that the second costal cartilage is attached to the sternal angle, as we described right over here. This is the Manubrium, and this is the body. So this is where the second rib begins. And this would be the costal cartilage, the cartilaginous part of the rib. You could see it right over here. So let's erase all of this so you're a little less confused. Okay, so this is the second rib. We use the second rib first by feeling the sternal angle, and then palpating the rib on the side. And then we count down 1, 2, 3, 4, 5, 6, or however much we need to go down. This is how we figure out which rib we are at while palpating and examining the patient. So another important point is that we know that the 7th costal cartilage bounds the upper part of the subcostal angle. So this is the subcostal angle that we discussed. And the 7th costal cartilage is right over here. So this is number 7. Now, at the tip of the 9th costal cartilage, the lateral border of the rectus abdominis, or the linea semilunaris, joins the costal margin. So this is number 8 and number 9. So we're saying at the tip of the 9th costal cartilage. That means right over here. This is what we're talking about. Let's change the color. So this is what we're talking about. This is where the lateral border of the semilunaris is. So the 10th costal cartilage forms the lower part of the costal margin. So this is rib number 10. This is the costal margin, the bottom part. You can see on the body right here. Let me show you with the laser. If you look closely here in the surface, you can see the margin of the rib cage. And this is how, this is the 10th rib forms the lower border, the lower part of the costal margin. One of the hard sounds is going to be discussed with the costal cartilages. So the tricuspid valve can be heard right over here between the 5th and 6th costal cartilages. So we'd hear it right about over here in the body. We're talking about this separately because, as we will see later, the other 3 hard sounds are clearly heard in the intercostal spaces, whereas although you can see that there's a space here between the 5th and 6th rib, many times in patients you would see that the 5th and 6th costal cartilages, they're actually much closer together. There's not a big intercostal space over here. So when they're merged, you would see the tricuspid area right over here. So now let's start with the ribs. And I think we're at number 8. So the ribs are the bony parts, the bony bars of the rib cage. So like we discussed last time, these are the costal cartilages. And this is the bony part of the ribs, extending back, the orange parts. They can be easily seen in people that are lean and those with less developed muscles. They're not that visible in people that are much more well-built. You may be able to see them over here, but that's about it. They are palpated counting starting from rib number 2 at the sternal angle, like we already discussed. So you find the sternal angle, you find costal cartilage number 2, this is your second rib. Now you count down 2, 3, 4, 5, 6. The significance of the ribs. So one of the significant points, as we've already repeated, we'll repeat it again. It is used to count the number of ribs. or used to count the rib number that we're talking about. It is also, the rib numbers are also used in the anatomical description of structures. So based on level, we might discuss, let's say for example, at the level of rib number 5, we have a specific heart sound. Or we could say the patient has a scratch or a stab wound in the 5th intercostal space. And other important significant points regarding the ribs is that on the back, the scapula lies over 2nd to 7th ribs on the posterolateral aspect of the chest wall. So let me just quickly show you that. Okay, so I was going to show you the scapula overlies the 2nd to 7th ribs on the posterolateral aspect of the chest wall. As you can see, his scapula is right here. And this is T7, and this is rib number 7. So this is the scapula. So you can see this is rib number 7, and this is rib number 2. So let's go back. So the 10th rib is at the lowest point and lies at the level of the top border of the L3 vertebra. So as you can see, we have our 10th rib right over here. And this is L1, this is L2, and L3 would be right over here. L3 would be right over here. So that's the level. And the 11th and the 12th rib do not join anteriorly like the rest of the ribs confined to the back. So you can see from in here, this is the 11th rib, this is the 12th rib. And you'd see that right over here. So this is the bottom of the rib cage, and this would be around at the level of L3 vertebra on the back side. And the 11th and 12th ribs, they would end, the 11th rib maybe here, and the 12th rib wouldn't come all the way to the front. So it would end somewhere around here, near the back. That's it for the ribs. Okay, so number 9. Thoracic vertebral spines. So I've numbered these all for you here. So the first prominent spine felt at the lower part of the back of the neck is that of C7. So you could see that over here. Now, let's see this on the body. So on the body, we can see this is C7. You could see a little bit of a depression right here. Right over here. Underneath this is the depression, and this prominence over here, this is C7. So you can start counting. You can feel them. You won't be able to see them properly on this picture, but you would feel them. You'd feel the spines, and you'd count down, starting from the first prominent spine. And this would lead you all the way down to, and you can also use this level over here. So as we discussed, the scapula lies at the level of rib 7. Take a look. And that would take us to the T8 vertebra. So if you're using the scapular line, you know it's crossing through T8. Wait, how much is that? 1, 2, 3, 4, 5, 6, 7, 8. Sorry, I made an extra one. Okay, so all the thoracic spines can be palpated along the posterior midline. And the significance is that the T3 spine lies at the level of the roots of the spines of the scapulae. So if you can see here clearly, this is the scapular spine. If you know, the scapula has a bit of a spine. And here's the acromion process that comes forward. So this spine is at the level of T3. And the lower border of the scapula lies at the level of T7 and T8. So this level. The superior border of T8 vertebra, or the lower border of the T7 vertebra. Okay, that's it for our bony landmarks.